Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. And that's why we have come up with a lot of programs, a lot of physiotherapy activities and events, online webinars, all of these things we are trying to do just to make sure that you can move better in your life, because that's our mission. Our mission is to help billion people across the globe move better. And with one such condition where we are very much passionate about in talking is cerebral palsy. Now when we talk about cerebral palsy, shaking leg is one common symptom that is very frustrating for a lot of parents. Whenever the child sits or stands, suddenly the child's leg starts shaking. Why does it happen, and what are the three most important and crucial things that you should do so that you cannot completely let go of it but reduce the shaking of legs? We are going to discuss that in today's video, so make sure to watch this video till the end. Let's begin. Friends, shaking legs happens basically due to a problem which is called as ankle clonus. Ankle clonus, as mentioned, is only a reflex where if there is a sudden activation of the reflexes on the muscle, it will lead to a repeated abnormal movements which would be seen. Now ankle clonus is most common, but similarly there is clonus seen in the TM joint, in the arm region, in hip region as well. But ankle clonus is one of the most frustrating problem for all the upper motor neuron kind of lesion. So ankle clonus is not only seen in children with cerebral palsy but is also seen in adults who are suffering from stroke, Parkinson's disease and even spinal cord injury. So what are three things that they should do? The three most important things in order to reduce the level of ankle clonus is number one, stretching exercises. Yes, stretching of the calf muscle helps to reduce or maintain ankle clonus. The more shorter the calf muscle, the more higher would be the ankle clonus. So that's the reason it's very important to stretch the ankle muscle or calf muscle of the child on a daily basis. So if you are a parent of a child suffering from cerebral palsy and if your child is showing ankle clonus, make sure to do ankle stretching on a regular basis. You can see a physiotherapist and learn the process. If not, you can also book an online consultation with us and we can give you an entire video consultation, and in that video session we can demonstrate you all the stretches and stretching practices that can be done at home. Now after that, the second most important thing in order to reduce ankle clonus is weight bearing exercise. Now what do I mean by weight bearing exercise? Exercises in which affected leg pushes the area. Now many a times you must have observed that when the child is trying to do sit to stand activities and the moment the foot touches the ground, the ankle or the leg starts shaking. That's where some additional pressure is required to be given over the heel region so that the body weights fall on it and there is a proper closed mechanics that is formed and the child would be able to do sit to stand activity. At the same time, the ankle clonus would be reduced. Unfortunately, if the ankle clonus is very severe, even in those scenarios the ankle clonus will be there, but with regular practice of weight bearing this can be reduced. And the third most important thing is helping or getting help of an orthotic device. So ankle foot orthosis is one such device which is very commonly used, right? So ankle foot orthosis also helps in reducing ankle clonus, especially if the child has got too much tightness in the calf region. Make sure that the child is wearing AFO throughout the day, if not throughout the day, at least 2 to 3 hours in a day, wherever he has to stay calm or static. These three things on a regular basis would be definitely helpful. Apart from that, eyes application as well as Botox therapy is also helpful to reduce ankle clonus. But when to use it is something which is doctor's discretion. So it's important that as a parent, you should stay informed about it, but at the same time, take decision only after taking consultation from doctor. So these were the top three things. Many of them must be knowing. This video was just a reminder to help you understand and remind that these three things are very crucial, very important. So make sure to add it in your day-to-day activities for your child. On that note, I'll end this video here and I'll see you in another video. Thank you.